WHIVLP-FM in New Orleans. We are Radio NOLA HIV with programming. That's right, programming dedicated to human rights and social justice. WHIVFM.org. We honor independent voices. We are not a radio station with a mission. No, we are a mission with a radio station. That is to end all wars. Before we get started here in our very special Saturday show, let me go ahead and just do a little bit of housekeeping and remind you that LaCille is a community-based organization. And they remind you that millions have rolled up our sleeves and millions are still counting on you for health, for loved ones, and for community. So be next in line to get your shot. Together we can halt COVID-19 and protect ourselves and those around us. There's still more information available at haltcovidla.com. That's haltcovidla.com. This is a friendly reminder from LaCille, a local nonprofit organization dedicated to the well-being of Louisiana. Welcome to NoiseFilter, the daily hour-long show. However, this is a special show that we're doing today because we missed our show yesterday, more importantly, because there's so much information that needs to happen. That being said, my name is Dr. Mark Allen Derry. I'm an infectious disease doctor in Louisiana, New Orleans, and sitting across the digital divide is my friend and yours. Say hello, Doc Griggs.
Hello, Doc Griggs.
How are you?
I'm good, man. There's a lot going on today.
There certainly is, and hello to everybody who is coming in to the chat. Thank you guys so much for joining us. Please, please, please like and share this stream. This way more people can find out what's going on. Today's show is going to basically cover the entirety of the slide deck that was leaked from the Washington Post. So before we do that, I do want to just do one thing, and that is to give you an idea. We're going to kind of go a little bit out of order as we usually do.
Doc, can you say again, for those that are joining in, we are specifically going to cover the slide deck that was leaked to the Washington Post.
That we are.
Everyone heard about yesterday, and as a consequence, our vaccines in Louisiana, our vaccine rate went up 114% yesterday.
Yeah, that's amazing. And good, but it's still scary because people need to realize that even though they're vaccinated now, it still takes 5 to 6 weeks to be fully vaccinated. We're going to start with this slide right here. We're going to come back to this slide deck. So it's real important that we just have a look at this slide here. And what I want you to is that I've shown you this table many times before. This is a table on the x-axis here tells you how infectious a virus is, okay? On the y-axis here tells you how deadly it is.
Going up, it tells you how deadly it is.
Going up, the more it goes up, the more deadly it is. So you see Ebola, bird flu, MERS, these are the most deadly viruses that we know. Thankfully, they're not infectious. They sit around here. What we're not seeing, thankfully, in life is something that's very highly infectious and also very highly deadly, all right? But what we are seeing is this new Delta variant now estimated, according to the CDC, is more transmissible than MERS, which is Middle East Respiratory Syndrome, SARS, Ebola, the common cold, seasonal flu, smallpox, and now it is as transmissible as chickenpox. And you can see the range by which it is now considered to have an R0 between 5 and 10. And what I've been reading is that it's an R0 at 8 or 9. So the reason why we're starting this,
Doc,
go ahead.
Explain R0. First of all, I want people to look at that. And I know where a lot of people are, smallpox, thanks to vaccines, a lot of these we don't hear about because the vaccines worked. If any of your parents or grandparents have that little dot, that circle on their arm, it was a smallpox vaccine. And from the chart, you can see how transmittable it was. The thing that I like to anchor on is the common cold. Some people have gotten the believe it or not, a chickenpox vaccine, and because of that, you aren't familiar with it. I had the chickenpox, and it was miserable. And I remember the chickenpox parties. If someone had the chickenpox and you hadn't had it, they would invite you over to play so everyone could get it and quote unquote get it over with. Basically, they were creating natural immunity. I mean, we didn't know what all of us didn't know 2 years ago, 19 months ago, but now you understand how natural immunity worked. What I want to focus on, anchor on, is the common cold. We all know people with colds are very transmittable. Everyone's had a cold. We get cold. We don't know how to prevent them, but we know how easy it is to catch a cold from someplace. The Delta variant is phenomenally more transmissible, more infectious, easier to catch than the common cold.
By a lot. So we're gonna just jump. We're gonna change the order. The reason why I'm starting with that to show you is to put into perspective. The reason why I showed you what the R naught is. Remember the R naught. Excuse me. The R naught is the number. It's the numeric value that we give to a virus to determine how infectious it is. The easiest way to think about it is that something that has an R naught of like 1 or 2 basically means you're going to give it to you. If you have the virus, let's say, you could give it to 1 or 2 other people. HIV has an R naught of 2. Ebola has an R naught of 2. Measles has an R naught of 15. The original ancestral or of coronavirus had an R naught of 2.5 to 3. What we are now seeing is that this new Delta variant has an R naught of about 8. So that means one person can distribute it or can transmit it to 8 other people.
Immediately, like that.
Right. And so this is what was leaked by the Washington Post yesterday. That's what we're going to review. Now, the reason why I'm putting that into context here today is I want you to look at these numbers and see, because these numbers are eye-popping, right, as to how insane things are, and we'll show you them in a second. But right now, we're nearing, was it 200 million cases? Yeah, we're nearing 200 million cases.
200 million cases. Wow.
Globally.
That's the equivalent of almost two thirds of the United States.
Yeah. The things to think about is what we know is 4.2 million, but yesterday cases were 43,187, and deaths 9,360. And so what we need to look at is this, and this is what we are seeing. That's why I started with that first slide. We're going to get back to that CDC slide. But what we hear is this incredible uptick in cases, and this uptick in cases is explained specifically 100% by Delta. So they say new cases have fallen sharply in India and Latin America, the hardest hit parts of the world. But worldwide numbers continue to rise, driven by Delta. Highly vaccinated regions like Western Europe and the U.S. are where cases are relatively low, but are climbing fast. In Indonesia, the Delta variant by hundreds, which is really tragic. Less developed countries trailing far behind inoculation. They're expected to lag in economic recovery. And what we're going to see is just an unbelievable amount of cases in the resource-poor countries.
So can you make that last point again and show the relationship between inoculation? Folks, means vaccination, right? For those that don't know, I try to help everyone. But show the tie between vaccination rates and what does it say about economic recovery?
That there's going to be a lag in economic recovery as well. Also significantly more between rich and poor.
So the longer, yeah, go ahead. Now, I was saying the longer it takes for people to get vaccinated, the harder the harder hit potentially you are economically. Go ahead.
Yeah, no. The other thing I was going to say real quickly, and I have so many slides to go over, Eric. The other thing I was going to say real quickly was that this is exactly, and this is something people like myself, people study infectious diseases, humanity and humanity's role on the globe is dictated by viruses. And this is yet another example of how a virus is going to, again, create more of an economic disparity between rich and poor countries, largely, 1, because of the pandemic itself, 2, by getting people sick, 3, and lack of vaccinations as well. So it's really important. We have to push to get the globe vaccinated, because this is going to continue over and over again. But again, we have a gazillion slides to get through. I want to get through these slides quickly so that we can get to the CDC slides. Anyway, we saw deaths going down, but it looks like they're going back up again, and that's something for us to keep an eye on as well. Hotspots around the world haven't really changed that much. What I do want to focus on is what's happening in the U.S. 35,689,184. Deaths are almost approaching 630,000. That's insane. death, look at cases. Dude, at one point we were down to like in the 14,000s, like 2 weeks ago, right? 99,470 with 418 deaths. Look at this. Look at this curve. This is insane. We are seeing like an unbelievable. Look at this. Look at the rate of change here. This is August going to be a very, very, very difficult month for everybody. Just to let you know, 150% increase in cases. It's unbelievable what
in
we're seeing.
2 weeks.
Largely
In 2 weeks.
vaccination. Yes, in 2 weeks. The national outlook is worsening quickly with fourfolding new cases per day over the last month. Hospitalizations and death are also growing. Cases, hospitalizations, and deaths remain well below peak levels. Okay, that's true, but I have a feeling that this is going to go up. Again, we're dealing with a new variant. This new variant, while it's not a different virus, it is something that is far more infectious. And see slides that were leaked by the Washington Post yesterday, you're going to see that it's also potentially more virulent as well. Apparently, I need to have a second cup of coffee in the morning before we do these shows. The highly infectious Delta variant has caused huge spikes in cases in Missouri, Arkansas, Louisiana, Louisiana right here. Look at that. Look at that huge uptick, which is averaging fewer than 400 cases a day at the start of July, now reporting more than 2,400 cases a day, which is unbelievable. That's in our fine state here of Louisiana. And let's just get to Louisiana real quickly, then we're going to jump to this Washington Post story. And here, the cases in Louisiana, 541,679. Look at, we're up to 11,000 deaths here. We're reporting 5,313 cases yesterday, and look at that uptick in cases, Eric. Look at that. That is just insane.
I mean, that is if I'm not mistaken, that slope looks to be steeper than this time last year, or I mean, higher than any time.
This is like, I mean, the slope is really, and remember we unpublished data from Kinza. There does tend to be, with the rate of the steeper the rate of incline, the more severe that particular wave can be. But look at, we were doing nothing. This is unmasked springtime event in July, blah blah blah. Boom, right up there. We're going to see hospitalizations are going up significantly as well, and we're seeing a small uptick in deaths as well. Here we got placed into the very severe COVID acne, placed us in severe, and just compared to this on Wednesday, we went up from 73 per 100,000 to 81, 82. Our infection rate is more or less the same at 1.5, and the test positivity is going. That means not enough people are getting tested. Folks,
Yep.
Go and get tested, okay? And here in Orleans Parish,
sore throat,
the mayor,
fever, headache, bad cold, not the no taste or smell. It feels like a bad cold.
the mayor yesterday, unfortunately, the governor equivocated yesterday and refused to create a mask mandate. The mayor of Orleans did, thankfully. I think that was the right thing to do. Yesterday, I went and played music in an outdoor of nobody wearing masks inside the bar. Nobody. It's unbelievable. Anyway, 6,400,000, 67,400,000. Infection rate is more or less the same, 1.5, and our test positivity is 12.9%. We're seeing in Orleans Parish that test positivity so high. Eric, I'm going to scroll up to the. Go ahead and say something. I
just want to paint a lens on this. So, in response to what we're about to go over, Louisiana, we might have been at a highest slope and at the top of the list again, but we responded, and hopefully it's a sign of what's to come. The number of vaccinations went up 114% in response to the news. We want to take care of ourselves, so that's a good thing.
The war has changed. Internal CDC document urges new messaging, warns Delta infection is likely more severe. We're going to over that presentation in detail. I just wanted you to see the document is an internal CDC slide presentation shared within the CDC, obtained by the Washington Post. It captures, and you know what, I'm not going to even go over just how ridiculous this is. And, you know, I'm just going to say my piece right now. The CDC needs to do a better job. This should have been leaked. It should not have been leaked to the Washington. Anyway, it captures the struggle of the nation's top public health agency persuading the public to embrace vaccination and prevention measures, including mask wearing. The document strikes an urgent note, revealing the agency it must revamp its public messaging, emphasize vaccination as the best defense against variants of contagious, that a different novel virus leaping from target to target more swiftly than Ebola or the common cold. It's a combination of recently obtained but still unpublished data from outbreak investigations and outside studies showing that vaccinated individuals infected with Delta may be able to transmit the virus as easily as who are unvaccinated, as we reported to you earlier this week. Vaccinated people infected with Delta have measured viral loads similar to those unvaccinated infected with the variant, and we did talk about that as well. And this is something that Eric has been, for the last week or so, has been talking to us about. So over the actual slide deck, there's one or two slides I don't understand, and maybe Eric will be able to help me go over and understand. But let me just prep this. And so this is the CDC site. For some reason, this was the person who was probably assigned to or whatever, and it was obviously blacked out. All right, look at what it's called. Look what it's called: improving communications around vaccine breakthrough and vaccine effectiveness. Unbelievable. At least they know, right, Eric? I mean, at least they know. At least they know that there's a problem, right?
Yeah, yeah, yeah. I mean, we hit a wall. We hit a wall.
Yeah, that's a good point. All right, so let's go over this slide deck. We're going to do, there's about 25 slides. There's a lot of information here. All right, vaccine breakthrough cases may reduce public confidence in vaccines. They know it. How come you're not out there talking about it? Okay, vaccine breakthroughs are expected and increase as a portion of total cases as vaccine increases. Vaccine breakthrough cases will occur more frequently in congregate settings and in groups of primary vaccine failure, such as those that are immunocompromised and the elderly. Communication challenges have been associated with increasing proportions of cases vaccinated even when vaccine effectiveness remains stable. You're going to see this VE all throughout the deck. Remember, VE stands for vaccine effectiveness. Concerns from local public health departments about vaccine effectiveness exist. The public's convinced vaccines no longer work, and that it's important to update communications describing breakthrough cases as rare or a small percentage of cases. I completely disagree with that. This right here, to me, is not good public health messaging. What do you think there, Doc Griggs? Because how many people are you hearing from your own circle that are like, I know a ton of people who have had breakthrough cases in your own personal circle?
Yeah, so it's been my experience on the ground in the personal circle and on the community that, you know, people are getting COVID in spite of being vaccinated. The best way to deal with that is say breakthrough cases are going to happen, but you won't end up in the hospital and die. We have the data, we have the facts to say that. We're dealing with a different animal than we were last year. We're dealing with a liger instead of a lion or a tiger. And folks, those ligers are a hybrid of the two, and they're really big. They're really big. This is a liger.
A liger. All right. I agree. Totally wrong messaging. It is so off. There are so many people who know people that have had breakthrough cases, and to describe them as a rare small percentage. Okay, so here's where the data starts. This is amazing data. This is something they should have released a long time ago. Now, this is something that we've known. Greater risk of disease, hospitalization, and death among unvaccinated versus vaccinated. So
this is what people want to see.
Right, so this is disease incidence. So this is actual COVID, right? You can see that those that are fully vaccinated in blue compared to those that are not vaccinated or unvaccinated, an 8-fold reduction in disease incidence. So it does protect you from disease. You can see breakthrough cases exist, but I guarantee you this data was not taken on Delta. They're going to be able to give us data like this the next couple of weeks, but this is just very likely this is alpha variant. You can see there's a 25-fold reduction in hospitalization and a 25-fold reduction in death as well. So this is what we are seeing. This shows us that vaccines work, and I know if people are vaccinated by now, nothing is going to, or maybe like Dr. Grigg says, you said what, that the vaccinations went up 115%?
Well, no, 115%, and it's because people are scared, and a lot of them are like, I know there's a lot out there, but I'm not a fool. If it's that contagious, I don't want to get sick, period.
Right.
And you're going to see a lot of people masking, because who wants to be sick?
Right.
Great that I'm
and
not
the
going to
masking
die. Great that I'm not going to the hospital, but I don't want to be sick.
Right. But how are you telling people right now? I mean, people are like, wanting to get vaccinated, but it's going to be 6 weeks, before they're fully vaccinated.
So it's the start of the process, and I keep going back to what we said the whole time. It's the incomplete public health tool bag. We have social distancing, not going in crowds, the mother wit, the common sense my grandmother used to talk about. If you know a bunch of people have a cold, you won't go jump into the crowd. If you know people have cold, you wear a mask. You put on a mask, you cover your mask up, because you want to be breathing anybody else's cold or virus, their funky breath. You don't want any of that. The other thing is that you need to if you know there's a way to get protected from being sick, starting the process allows some protection. But in the meantime, we act as though this is a novel virus again. This is a novel variant. It's not like the other variants, and we treat it with the respect that it deserves, because the virus doesn't care about us. We have to care about us.
That's right. The virus does what it does, which is to replicate. All right. What this is showing here is increasing percentage of vaccinated persons amongst those. Right. I didn't quite understand this slide. So this one doesn't make a lot of sense to me, but I'm gonna tease it out. So this is in-hospital deaths who are fully vaccinated. And you can see as more and more people were vaccinated, compared to those that were unvaccinated, these are still fairly low numbers. But it did go up with alpha right here, right? Those that were fully vaccinated, and then this is hospitalizations. So what they are assuming here is that this reflects an increased coverage, higher coverage in older, higher risk among all age groups for hospitalization and death relative to younger people. So essentially, what they're saying is that even if we're fully vaccinated and we see an increase in mortality, it's likely happening in those that are elderly or those that are possibly having some sort of immunocompromise. That's how I see that data. Any comments here, Eric?
No, I think we're seeing it the exact same way. Increasing percentage of vaccinated amongst those that are hospitalized. You're gonna see that. Again, I go back to what I've been saying. An infected person is bringing out 1,000 times the concentration of virus that a person last year would. Compared to last year, we are all breathing in air that has 1,000 times the concentration of viral particles in it than last year by infected people that aren't wearing masks.
Absolutely. And then I just wanted to, Kevin Caldwell's as bartender, as a DJ on WHIV at a local bar, trying to keep on people's masks was a nightmare last night. I imagine probably was, and it was. I played outdoors as well last night, and it was a nightmare inside the bar. They were looking at me like, what was wrong with me now? Granted, I was in Jefferson Parish, but they were all giving me the stink eye for wearing masks. It was unbelievable. All right, so this slide here is just looking at the different study types. This is is not necessary. All right, so vaccine efficacy results. So we're going to look at how effective the vaccines are. This is, again, remember, this was a leaked slide deck to the Washington Post. This was a CDC leaked slide deck. So urgent providers that vaccination may reduce transmission and attenuate illness. Now remember, this is not Delta. What this is the alpha wild type, or very likely to be alpha virus. And so what they found was that it was effective at 91% against infection. Remember, and this is a very important point, and a point that I want to make over and over again, that the vaccine now, with the Delta variant, does not prevent against infection. It reduces, okay?
The alpha variant and the wild type variant, right? Those variants were the vaccines, the mRNA vaccines, and Johnson & Johnson protected against infection, but we lost that now. And that's why we're seeing so many so-called breakthrough infections right now. And it's an important point. But what we're seeing here is not, we're seeing this is alpha variant, right? And 81% against partially vaccinated. So we see that this is a very effective vaccine. And compared to unvaccinated cases, vaccinated cases, full or partial, had a 40% lower mean RNA viral load. That's for alpha variant, right? Because it's not the case anymore. Shorter mean duration of detectable viral RNA, lower risk of febrile symptoms. This means fevers, shorter mean duration symptoms. These are for breakthrough cases. So essentially, what they're teeing up here is in this study, the Heroes and Recover study, that the vaccine in healthcare workers, those that are on the front lines, was incredibly effective at reducing the likelihood of being infected in the first place. And if you did get infected, you had less virus and you had less symptoms. So these are a few other studies that were done as well. The Vision study, it had protected against hospitalization 88%. And again, these are still looking at hospital healthcare systems. These are healthcare workers. They found no evidence of waning immunity 16 weeks post-second dose. So this is, again, this is information we already knew. Vaccine efficacy against hospitalization, 87%. Vaccine efficacy, 90%. So you can see 3 different studies. You're hovering in the high 80s, essentially. I'm sorry, yeah, the high 80s, low 90s. Now lower.
You see in the red, they did allow for preliminary, confidential preliminary data subject to change, kind of acknowledging that the window of the observations was prior to Delta, right?
Right. Mm-hmm. Let's be very clear. This is pre-Delta, and that's really important for us to recognize. Okay, Delta is changing everything. Lower estimates of vaccine efficacy for mRNA vaccines among immunocompromised. Okay, so we've known this as well. Now, how are they defining immunocompromised? Recipients of hematopoietic cell or solid organ transplant. So this is stem cell or solid organ transplant. Patients under immunosuppressive therapy, such as steroids or other biologics. Splenia means having no spleen, having your spleen taken out. Chronic renal failure, that's kidneys, advanced kidney disease, dialysis, or nephrotic syndrome. So that's how they're defining immunocompromised. And what we've known is that people who are immunocompromised we're not seeing a robust antibody response after the second vaccine, and so people are opting through studies to get a third dose. And so that's what this slide deck says. These different studies showing that people who are immunocompromised are not protected. Now, what they're also showing here, again, and this is alpha, is that lower estimates of mRNA vaccine effectiveness amongst home residents. Again, this is largely due to the fact that you have people who are in congregate settings, that are elderly, and that also have chronic illnesses like renal disease or immunosuppressive diseases. And you can see that it's hovering between 65 to 75%. Okay. Now we start talking about breakthrough cases. So this is just a model of how they're measuring their breakthrough cases. And vaccine breakthrough in long-term care facility residents, where coverage is 80% nationally. For infection, the vaccine was 61%. So you can see that you are still getting people. It protected only 61%. Just for mild illness, it protected 75%, and for severe illness, 85%. Again, these are in the elderly who live in long-term care facilities. So here's what they say.
Can you go back to that real quick? I want to look at that number again, because there were 2 numbers in that, right? Remember where you said protected? So the vaccine was 38% of the cases vaccinated, 50%. Are they saying 61%? What does the number mean after 61% of the cases?
Remember, I told you there's a couple that didn't quite make a whole lot of sense.
Yeah.
So I think that 61%. I think if you go here, 61, it's hard to.
That's a little. Yeah. Okay.
Basically,
we'll talk about that one offline.
Yeah. Okay. So here's here's their messaging. Communication challenges around vaccine differential. Vaccines were more effective against hospitalizations, more than illness, more than infection. Okay, so it's important to acknowledge lower vaccine efficacy against infection. This is so important, and how they have not talked about this has really been they know about it, okay? So vaccines were more effective against hospitalizations, illness, and infection. That's what we are seeing right now. We're seeing a lot of breakthrough cases. We're not hearing a lot from them, but they are admitting that it's important to acknowledge that you can get infection. Vaccine efficacy estimates represent an average for group rather than individual risk. Risk modified by age, immunocompromised, need to clarify messaging around individual protection. So, Eric, why don't you break this down? This is your bailiwick right here.
So here's the deal. So what we're seeing, actually, folks, is we're seeing the results of it's the messaging at the very beginning. The World Health Organization's cutoff for the safety and efficacy of a vaccine in the general public is 50%. We started off at 90 and 95 at the very beginning with the messenger RNA vaccines, which is unheard of, and it was great. But that was against the wild type and the earlier variants. Now what we're seeing is something similar to what we see with the flu vaccine. We know that the flu vaccine can prevent you from catching the flu, but it's not 100%. But we're all rest assured that by getting the flu vaccine, we won't get as sick. It might be a shorter duration. We're watching the evolution of the vaccine process as the virus is evolving to become more infectious, and hopefully, actually not more lethal and more infectious. Over the natural life cycle and evolution of viruses, they tend to get more infectious. I don't know. This is unprecedented, but as this virus presents in the community, what we're saying is the vaccine, as that one equation, side of an equation that said it's most effective at preventing death, most effective at preventing hospitalization, death and hospitalizations, less effective, but still more effective than getting infected from you getting sick. When we say illness, we mean getting sick, and it is least effective in that comparison at preventing infection. Whereas before we were comfortable saying that it could prevent infection, this Delta variant, you get the vaccine and it'll prevent you from getting sick, less so than it will prevent you from, less so than it will prevent you from dying or going to the hospital. The vaccine will stop you from dying. You feel comfortable that you won't die or go to the hospital, even though it can happen if there's a small risk. There's a larger risk that if you get infected that you might get sick, and there's a larger risk that you can actually catch it. The environment, because it gets in your body and replicates at such a high concentration, that the likelihood that it could still overwhelm your immune system and make you sick and infect you is higher. So in fact, you're not 100% protected from being infected or catching it, but if you catch it, you have less of a chance of going to the hospital or dying. And in the middle of that, you still might get sick or feel bad, have a mild to potentially, it won't be a moderate case, because a moderate case with COVID, remember, is being in the hospital. You might get, you won't get as sick, simply put.
Absolutely. Yeah, no, I mean, you're just basically to understand this. But what I'm blown away by is that they know this. They knew this, right? How do we communicate this to the public? Comparisons to unvaccinated that are relatively stable, personal stories, examples from outbreaks. So it almost seems like they had their communications people like just basically sharing with them, but they've acknowledged that they are losing the information messaging to the public. And so this is just, it's a remarkable peek behind the curtain. Okay, now we get into the Delta variant. All right, here's that slide that we started off with. Again, this is basically a slide that basically tells you on the x-axis how infective a virus is, and on the y-axis how deadly that virus is. Fortunately, in life, we've had very deadly viruses that were not very...
You need to change the slide.
What?
The slide?
Oh, we need to change it.
I still see communication challenges around VE.
Oh, really?
Yeah.
I'm showing that.
What are y'all seeing? What is the group seeing? I see the same slide. Vaccines are more effective against hospitalizations
Here.
and death.
Let me do this. Let me start over.
Folks, bear with us. This is an impromptu Saturday edition. There we go.
Right. Okay, so again, just in case, this slide is an incredibly important slide. I show it all the time. I teach to this slide all the time. The x-axis tells us infectious a virus is, right? With measles being the most infectious virus of all. This y-axis tells us how deadly, how virulent a virus is. What we see here is that a majority of the most deadly viruses that affect humans have been fortunately very low in infectivity. R0s are very low. Okay, what we have fortunately never seen in human is that a virus that is in this quadrant right here that is very deadly and that spreads very fast. It's very effective. But look where the original wild-type SARS-CoV-2 virus was, and look where it's moving to. It is slowly migrating to becoming a little bit more infectious, and it could be migrating a little bit more virulent as well. That would be unprecedented, because you can see that this has not ever been done before. Usually viruses are very infectious, but they have low death rates, or they are very deadly, but they have low infectivity. We've always kind of counted on that. So this has been a truism. All right, so now let's get to the data. So Delta infections associated with higher viral load and duration of shedding. So gone is all of the public health kind of guidelines that we had thought about quarantining. All that was for the wild type variant. This is unprecedented. This is why we have no new guidelines. And Eric, I'm sure you get 10 to 20 calls like I do. Hey, somebody's in, how long do they need to quarantine for? What do they need to do with their family? Da, da, da. So what they found here was that in India, the study in India showed lower cycle thresholds. That's the PCR. Basically, this is tech language. Basically, what they found was that people who had the Delta virus had far more evidence of the Delta virus than people without the virus. They found that it's associated with a longer duration of upwards to 18 days of shedding. Now, again, we don't know if it's live virus or not, so we need to understand that, but they were still shedding virus. Risk of reinfection with Delta may be higher, but only if prior infection was 188 days earlier. So what they're saying here is that you could get reinfected with the Delta if you were infected 180 days earlier. So that would be with the wild type strain. They not mention or not being vaccinated has anything to do with that. Anything here, Eric?
Yeah, so comment? I want to, you're getting questions in the chat, and I've gotten questions that people are wondering how long they should quarantine. Again, if you run into a doctor, scientist, anybody that has a platform that's not willing to tell you, we don't know, because we're studying, the default would automatically go to say that you'd want to quarantine for the 14 days, but we don't know. You see that the infection is associated with a longer duration with a median, which meaning an average of 18 days versus the 13 days, which is where we got the 14 days of quarantining from. So right now, to be safe is, I don't know.
I don't know.
14 days and then test again afterwards. But my answer would be, I don't know. We have to go with what we know is while the data is being put together.
We have no guidelines. We have no guidelines.
None. So all we can do is go with what we know, which is, you go with the 14 and quarantine, test until you're negative, which is tough because, like Dr. Gary just said, we don't know whether that's live or remnants of a dead virus. We're in a gray zone of science right now.
So this is the big study that dropped earlier this week that changed everything. The Delta variant vaccine breakthrough cases transmissible in vaccinated cases. Vaccine breakthrough cases may be as transmissible as unvaccinated. Breakthrough cases reported to national passive surveillance have a lower This is again a lower cycle by 3 cycles. Just real quickly, all that really means is that a PCR test amplifies the genes of the virus, right? So when you do the swab, you get a genetic, you get samples, parts of the virus, and the PCR amplifies it. The lower the number of cycles that it goes through means that there's a lot more virus available for it to pick up on. If it has to go through a lot of cycles, that means that there was smaller. And what they're finding here is that they're doing lower cycles for the Delta virus. What that means and how that's translated is that there's a lot of virus when it comes to Delta. This is what Dr. Griggs on CNN, this is what he was sharing with the reporter last week, was that you have 1,000-fold more variant available per one alpha virion. And here's the big difference, or the big news, that there's no difference in mean cycle values between vaccinated and unvaccinated. And what that essentially is saying is that that people vaccinated and people who are unvaccinated have the same viral load. That's really important for us to know. Eric?
Yeah. I mean, that just summed it up. That's what I've been saying all week. I mean, that's
right. Remember, masking, it's not punishment, protection.
It's not punishment, it's protection. And folks, this is the reason we're doing this is kind of to show you why. We need to use all the tools in our tool bag. All
right, this is the one that's distressing. Delta variant may cause disease than alpha or ancestral strain. In Canada, there are higher odds of hospitalization, death. There was, in Singapore, higher odds of oxygen requirement, ICU admission, death, and pneumonia. And in Scotland, higher odds of hospitalization. So we are seeing potentially a more virulent strain as well. And here I'm seeing a 2-dose vaccine.
Make sure you put in that's relative to the alpha strain. I don't want people to freak out. That's relative to the alpha strain, right? And yeah,
right.
It's relative to the alpha strain. Yeah.
Yes.
Sorry about that. Go ahead. I'm sorry.
Yeah, that's okay. This is just showing that the delta is in red. That when you're looking at infection versus symptomatic disease versus hospitalization, when you look at Israel, something's happening in Israel. I'm not sure what, because England, Scotland, Canada didn't see it. But the Delta, you could see this confirmed infection, that there was breakthrough cases. So that's what that's telling you. Here, this is telling you that there was significant symptomatic disease, but it did protect you from hospitalizations or death. There was better luck apparently in England, in the UK, and Canada, but in Israel, not so much. Mine is that breakthrough cases are known and are going to be more and more common as we, especially because we're behind the 8 ball. The governor yesterday should have put mask mandates in. The president needs to do mask mandates. I mean, this is the only way, because we have 50% of our country is not immunized, including children under 12. And remember, children can get long COVID. They get long COVID at the same rate that adults do, about 10 to 15%. So this is just a modeling here, and based on that model, what they did was they modeled some data, and what they found was that given the higher transmissibility and current vaccine coverage, masking is essential to reduce transmission of the Delta variant. And this is why they came out on Tuesday, Wednesday, and said everybody needs to be masked again. They did not, needed to be far more, they needed a stronger messaging. Summary, Delta is different from previous strains. It's highly contagious, likely more severe, and breakthrough infections may be as transmissible as unvaccinated cases. This is the big deal right here. Vaccines prevent 90% of severe disease, but it may be less effective at preventing infection or transmission. Therefore, more break and more community spread despite vaccination, and non-pharmacological interventions, that's social distancing, are essential to prevent continued spread with current vaccine. Next step for the CDC, communications. Look at this, exactly what we need to send this to Graylin. This is exactly what we've been talking about. Knowledge the war has changed. Improve public's understanding understanding of breakthrough infections, improve communications around individual risk among unvaccinated, risk of severe disease or death, reduced greater in vaccinated, great, but risk of infection reduced only threefold. So there you go. That's where your breakthrough's coming in.
And additionally, show the correlation between the flu. It's the same thing. The same mindset that if I get the flu shot, it might not prevent me from being infected, but I won't get as sick. I won't get as sick. I won't go to the hospital, and I won't die. The whole purpose of vaccinations on a big scale is to keep people from dying and to overburden our hospitals, to overwork the healthcare workers and log jam the system, because it logs jam the economy. Everything has to stop when we can't go to the hospital for a heart attack, for babies being born, for auto accidents, for just accidents, the things that we need to go to the hospital for. When we have to stop having surgeries, people that need surgeries, like people with different stages of cancer, and they have to delay it, they're in a fight against time for their lives. So the point of vaccines is to keep everything functioning. If we ever get to the point that you can catch COVID, be sick and out for a few days, wear a mask if you have to go out, stay out of the public, feel better, and go back into the system, we'll be able to continue functioning as a society and a world. This is all, we're just living the evolution of this. And unfortunately, a lot of people are going to have to suffer.
Unfortunately, that's the case.
Because of messaging. We got to fix the messaging.
Absolutely, 100%. And they know it. They know it. This is evidence that they know it. This is why it's news. This is why the Washington Post publishes. Then lastly, next steps for disease prevention, consider vaccine mandates for all healthcare workers. Yes, of course. Of course, of course, of course. Universal masking for source control and prevention, and reconsider other community mitigation strategies. So that was what was broken by the Washington Post. Let's go through your messaging here. Let's see. Mignon says, for breakthrough cases, even though the symptoms are mild, any concerns about future medical effects? Yes, huge concerns. That is a major concern. I am so concerned about not just long COVID, but what could happen to your lungs, what could happen to your endovascular system, what could happen to your heart. Yes, I am concerned. Even if you are asymptomatic, I am concerned. This week, when I wasn't well on Monday. I got my COVID test. Thankfully, it was negative. But I was not necessarily concerned that I was going to get sick and go to the hospital. I was concerned that what the long-term effects of COVID could have, and that was what I was mostly concerned about.
I mean, we have to live through it. We have to do what we can to keep from being infected. Do air purifiers? The HEPA filter systems work? Absolutely. They work, but they have to know their square footage of the room. Every public health, what do they call it? NPI, non-pharmacological intervention. All of them work. We know that they work. We know that we've seen them work with other things. The HEPA filters, the masking, the social distancing, washing your hands. I don't care what anyone says. Don't stop washing your hands. All of it works. Staying away from people if you don't feel well. Wearing a mask if you have to go out in public. All of it.
But the other thing, the thing about home purifiers is that it's just you're at home, and theoretically with your family. That would be so. Well, I mean,
I think they meant the class of home purifiers, because like in office spaces and in public spaces, there are a lot of offices that a lot of people put those into their air filtration systems at work that they could. It's all about ventilation. Remember, ventilation works. That kind of got lost in messaging when we started talking vaccines and variants and stuff. It's the ventilation.
Yep, absolutely. Layla says here, I feel like it's common sense too. If someone who is vaccinated, they have mild symptoms, some are coughing up a lung. If someone gets seriously ill, won't they be spewing out more virus? That's hard to say, but I think the important point is that right now with the Delta variant, that people who are vaccinated can have the same viral load as people who are unvaccinated. So you have both groups of people that can transmit equally, and this is why it's important for all of us to have masks on. Of course, this is only at such a great point. Is 14 days quarantine still the rule for Delta variant, or is it lasting longer with its higher viral load? Smitty, it's so great to see you. This is a friend from way back on the reservation, Doc Griggs, when I lived on the reservation. That's a great question. We don't know yet. This has not been determined. This is really the $64,000 question. We're waiting for those guidelines. I was hoping that in that slide deck there would be some indication, but unfortunately there wasn't. Any thoughts on that, Doc?
What we saw is that it looks like the median time that there's a detectable viral load is 18, but we can't hang our hats on that because everything is still being studied. So the answer is we'll see. And I know it's frustrating to hear the people you're looking to, the scientists tell you we don't know, but you're looking behind the curtain while it's being done. And this is all part of the scientific process. Hopefully we'll spend as much time on how we communicate our messaging moving forward as we do on the actual experiment, because it's important to keep everyone, the more transparent that Doc and I try to be with y'all, hopefully the more you trust what it is that we say. And when we don't know, like now, don't know, what would we recommend people to do? If we know 14 is what it is now, do 14 and then get tested, and you just have to see. Until we get guidance.
It's 14 until we get guidance. That's exactly what I'm telling people. Here, Mignon says, when should immunocompromised get their third vaccine? You cannot right now in the state of Louisiana go get a third dose unless you are part of a study or your doctor has been now I work with immunocompromised individuals, but my immunocompromised individuals are really healthy, right? So HIV is not on that list, right? So that did not compromise. So if those people who are rheumatologists or what have you, who deal with immunocompromised individuals, they may be given permission to do third doses. But right now, you can't go get a third dose right now. It's a great question. Let's see. I heard people say we should no longer call it a vaccine because it's not working.
It's not true. It's not true.
The flu vaccine has 50 to 60% efficacy every year. This has 95%.
Threshold from the World Health Organization for a vaccine to be considered effective is 50%, and we're way beyond that. You're just watching. We're all part of this science experiment, and we just happen to be watching as it happens. But the vaccines are still very effective.
I had several friends who have breakthrough cases, mostly fatigue and feels like light flu, which is a messaging is a field day for anti-vaxxers. Also had a friend of mine, my age, died this week, who was unvaccinated. I think there was I do know of a musician who died this week, a New Orleans musician who was part of the metal scene. Apparently was just an amazing musician. He died. So I don't know if he was vaccinated or not, but yes, we are still hearing about people who are dying. Leila again says, I'm so sorry, but I'm confused. Last year this time, it was going back to school that was causing me anxiety. Now it seems it's not a question about schools going back. It's gone to masking. That's a very good point. Some states are not even requiring masks in schools. Yeah, it's and then the rest, I can't see the rest of her question. Last year I did not teach band because of the obvious, so why is this being much scarier? Why is band a thing? Why does it seem like things are much worse and scarier, but people are backtracking? It's just like masks now. That's not all that it takes. That's a good point. Lynn, I think what you're saying is that last year there was a sense of fright, and the virus that we were working with was far less infectious than what we're working with now. We're working with something that's far more severe, but everybody seems to have like a very lackadaisical approach. Not us. This is why we are doing this right now, and you can see
on a Saturday.
On a Saturday, you can see our
every day
concerns.
Tuesday.
You can see our concerns, but I hear you totally.
So Leila, here's the thing, and just to allay, unfortunately, this is not a movie. We can't fast forward to the end. We can't click through and press for the 3 hours to see. This is all part of the process that we're going through until the messaging gets out that we are where we were last year at the very minimum. The difference is that we do have vaccines that can help in the fight. Last year, this time, we didn't have anything. All we had was the NPIs, the social distancing, masking, and the washing of our hands. People have been fighting us with masking 2 tooth and nail ever since the possibility came up. There was mixed messaging at the very beginning, which we should have just stuck with it and stick to our guns. Now we're sticking to our guns. Drawing the line, wear your mask, and we need to keep putting that out there. This is much more infectious. It can make you sicker. We're finding out more and more about it. It's a different animal, though it's related. It's a different animal. So the best thing you can do is the things you can do for yourself or get vaccinated. Keep as much space away from other people and congregating as possible, and wearing a mask. We'll get to the types of masks and all that stuff later. Right now, I just want you to cover your face, so in case you're infected, you're not breathing out or you're not breathing in someone else's virus.
That's right. Where's the guidance on quarantining? Will be in schools. You've got me. It's unbelievable that we're in this situation. Here, Jamie says that I'm a nurse in a never-ending war. We need more masks. Let's see, replying to, not to mention PTSD that nurses are going through, which hurts the brain, triggers stress response, lowers the immune system. Frontline workers are going to end up with poor health if this continues. 100%.
Which is why self-care and being mentally, listen, folks, do not get, remember, I'll bring it back. Breathe, check, step back, go to the bathroom, wash your face, walk out, flush the toilet, leave it all there. Smile, forgive yourself and smile, because we got this. We're going to get through it. That's why Mark Allen and I are here. We've been here every step of the way, and we'll be here the whole time. Yeah,
thank you, Mignon. I think I will reach out to Shyla. She said that she definitely wanted to be on the show again. So we'll definitely reach out to her and have her on. Sorry says that there's going to be an in-person meeting. I want to bring my home purifier with me. I would, yeah, an in-person meeting right now seems like that does not seem. Yeah, I would. Yeah, I would have.
Make sure everyone's masked.
Right. How would families handle this if everyone tests positive? How is it possible to thoroughly cleanse the air in their homes? Yeah, listen, if somebody's positive at home, you're going to have to just like either send them away if everybody else is negative. If everybody else is positive, everyone's just going to have to be positive together. But it's a very good point. Are the antibodies being given to people who come to the hospital?
I'm not sure about that. I don't know.
Yeah, I don't know if Delta is if the antibodies work against the Delta variant. I don't know. I know that they was becoming less and less effective. And let's see. Here somebody says, Carrie Lynn, hey Carrie, says, I always thought that the more the virus spread, it became weaker. Yes, yes, that's exactly right. I don't know if you saw that earlier. That's exactly right. But it seems to be getting stronger.
But Mark, I'll define weaker. As the virus evolves, it gets more
less virulent. Sorry. Less virulent.
Right, but we don't know. We're still finding out. Remember that first slide we said we're hoping it's not trending towards increasingly virulent. We don't really know. We know it's getting more infectious, and that's what they do. But Mark Allen, do they really evolve this quickly, like from 1 to 1,000 times?
Yeah, I mean, this is unprecedented. What we're seeing is unprecedented. Obviously, this has happened in human history before, but not like anything like this. Also, the fact that we travel and the fact that we just live into this post-truth world where people are just, you know, every person who's infected is a new variant, can create a new variant. We have 30 seconds left. There's no supplements you can take. Thank you guys for
get moving. Eat real food, drink water, get some sleep.
That's right. Thank you guys so much. We will be doing a show on Monday for you all.
If something should happen, we might do an abbreviated show tomorrow if anything should happen. But folks, we're here.
Thank you guys so much for tuning in on Saturday. We love you guys.
Have a great weekend.
Health is a human right. Love you guys. Stay safe.
Get your vaccines and wear your mask.